Women's health is a fundamental to overall well-being.
PCOS is a common medical condition that I see in young women when this goes on for months and months. So we're talking 6 months, 7 months. The number one killer of women is heart disease. About 80% of American women will be diagnosed with a fibroid. The average woman is undiagnosed for about 7 years when they have endometriosis. Surgery is the favorite option when it comes to fertility.
Surgery has a role, is an option, and has to be done.
The robotic surgery has been an amazing advancement in our field. You need to see a gynecologist every single year. And the second thing is just go back to the basics in terms of eating well and moving well.
In each episode, we dwell into the realms of wellness, exploring the latest trends, expert advice, and practical tips to help lead you a happy, healthier life. We aim to bring a broader perspective to our American audience on issues that impact your daily life by interviewing guests from the US and around the world. From nutrition and fitness to mental well-being and beyond, we're here to empower you with knowledge and inspiration. So whether you're looking to boost your energy, revamp your diet, or simply trying to find a balance in your lifestyle, you're at the right place. Join us as we embark on a journey towards a better, brighter you. I'm your host, Dr. Amir Khan, and together let's unlock the secrets to living life to its fullest. Women's health is a fundamental to overall well-being. Yet conditions such as fibroids, endometriosis, and menopause, they're often underdiagnosed. They leave many women frustrated, many without proper care, and many without solutions they deserve. These healthcare challenges can deeply affect a woman's quality of life, yet awareness and open conversations about the advanced treatments available remain very, very limited. Today, we aim to bring attention to these important issues. We want to explore innovative and minimally invasive solutions, not only to help tackle these concerns, but also empower women to lead healthier, pain-free lives. Welcome to another episode of Khan Klinics, the health section. I'm your host, Dr. Amir Khan. Our guest today is Dr. Cheruba Prabakar. Dr. Prabakar, widely known as the Fibroid Doc, she is a distinguished board-certified obstetrician gynecologist and fellowship trained in minimally invasive surgery, specializing in the treatment of fibroids, endometriosis, and other difficult gynecological conditions. She is the founder and CEO of the Lomarinda Gynecology and Surgery in California, where she offers advanced surgical treatments, including robotic surgery, to help women achieve optimum, brilliant health outcomes. Dr. Prabakar's academic journey is remarkable. She holds a neuroscience from Smith College, earned her medical degree from University of Connecticut. She further honed her skills during her residency at North Shore, Long Island Jewish Hospital, and completed a prestigious fellowship in minimally invasive surgery at Maimonides Medical Center in New York City. Beyond her work, she's certified menopause practitioner. She actively supports women's health as a member of the Advisory Council for the Alliance for Women's Health and Prevention. Let's talk about the latest breakthroughs that are challenging women's health. Dr. Prabakar, welcome to the show.
Thank you so much, Dr. Khan, for having me. That was such a wonderful and warm welcome. I appreciate it. And I'm excited to dive into these topics that you had mentioned to help educate women and, as you said, talk more openly about it.
Well, excellent. Well, let's talk about something then first, polycystic ovary syndrome, PCOS. It's a common
Yes.
condition that impacts the lives of many women. Tell us a little bit about it. What knowledge or information would you want to impart to our audience?
Yes. So PCOS is a common medical condition that I see in young women, starting really from the early 20s. One of the things to know about PCOS is that it is a condition that is caused by not ovulating regularly. So if you
Mhm.
don't get a period every single month, it means that you're not ovulating regularly. And this could be for many different reasons. You travel, or you're stressed, or whatever. Women can miss a cycle here and there. But when this goes on for months and months, so we're talking 6 months, 7 months, and you get a period just once or twice a year, this is the hallmark of PCOS. And the reason we care so much about PCOS is that there is a link to metabolic disease. And
Mhm.
as we know that one of the number one killer of women is heart disease. And so we think about metabolic disease like high blood pressure and cholesterol and diabetes, and
Right.
PCOS is linked to this. And so
Wow.
this is one of the reasons we stress, really talk about it. But that is what I want everybody to take away, that it's linked to metabolic disease, and that it's characterized by not ovulating or not getting your period regularly.
Brilliant. Well, thank you for explaining the disease overall, Dr. Prabakar. Tell us then, what's your strategy regarding managing PCOS, and do you take a holistic approach to improve their health? Tell us both the
Yes.
differentiation a little bit and how our audience will understand.
Yes. So there's a lot of things that we can do medically to manage this anovulation, or this process of not ovulating. So we
Mm.
can start birth control pills and various hormonal medications to regulate someone's cycle. And the reason this becomes an issue is many young women want to get pregnant, and if you don't ovulate, well, you can't get pregnant. Your ovary is not releasing an egg. So, for those purposes, yes, we can definitely look into medications to make that happen. But underlying all of this, what is the fundamental cause of PCOS? While it's not
Mhm.
fully understood, we know that lifestyle can play a big role. So in my patients, I am constantly counseling them on eating well, maintaining a good diet, exercise, stress management, all the things that you and I know affect
Right.
health, all aspects of our health, really. It comes down to fundamentally doing this. And I think many people, many young women are struggling with this. So those are kind of the two approaches that I take. Fundamentally, lifestyle, but then if we want to fix the cycles and help with fertility, there are certainly a bunch of medications we can try as well.
Excellent. Well, thank you for explaining that. So, just for our audience, there's treatment out there. There's definitely a role for the medical providers to help you. And these women are, like Dr. Prabhakar is saying, are young women. They're a lot of times suffering, and they go months and months. And Dr. Prabhakar is saying it can go 6 months, and at times you got to seek help. And I think that's the important message. And there's treatments out there, there's help out there. There is medical and non-medical treatment for you. So excellent, and thank you for explaining that, Dr. Prabhakar. That's going to help. We're going
Yes.
to dive into the next part, and then something that's very close to you, and that's endometriosis and fibroids, two conditions that countless women have. And a lot of times these are very widely misunderstood. Help our audience, please, Dr. Walker, understand these conditions, and help us highlight a few of these key symptoms, and then we'll later on dip into the treatment and how you come in.
Yes. So fibroids and endometriosis often coexist together. And about 80% of American women will be diagnosed with a fibroid by the time they're age 50. That is 4 out of 5 women. And if you're
Wow.
African American, or even South Asian, your risk even goes up more. It's 90%. So
Wow.
that's
Strong.
staggering. I don't think people
Mm.
quite realize that. And prior to me diving into this work, I myself didn't know that. So it's really, really, really common. And a lot of times, many women may not know that they have fibroids. They're often, they don't present with any symptoms, but other times they can cause pain, they can cause heavy bleeding, they can cause infertility, and all of these symptoms overlap with endometriosis as well. So, just to break it down very simply, what is a
Sure.
fibroid? A fibroid is a smooth muscle tumor of the uterus. It is not dangerous. It is not cancer. It is most often just benign, but it forms in the uterus as these balls. Sometimes they're small, sometimes they're extremely large, and they can cause pelvic pain, bleeding, and infertility. Now, endometriosis, on the other hand, is a condition where the glands of the uterine lining go backwards through the fallopian tubes, and then they start to implant in various portions of the pelvis. So it can be on your bowel, it can be on your bladder, it can be on your ovaries.
Mhm.
And so
Mhm.
every time you get your cycle, all these implants start to get active and cause cramping and pain. And so endometriosis is often characterized by very, very painful periods, sometimes painful bowel movements, painful sex, painful urination. Wherever these implants are, it can be affected. And so these are kind of the basic
Mhm.
differences between these conditions. And both of these conditions go undiagnosed for years. The average woman is undiagnosed for about 7 years when they have endometriosis. And even fibroids, because you can't always feel them, many women go undiagnosed. So they're big problems, and something that I want everybody to think about if you're having
Yeah.
these symptoms.
Dr. Prabhakar, you've definitely shocked our audience, because if this condition goes undiagnosed, and you said 80%, and then sometimes even 90% for women of color, that's staggering and that's very
Yes.
worrisome, and something that could be diagnosed and could be treated well. So
Yes.
tell us a little bit about how would you approach and manage these patients, and what can you offer them to relieve their pain, their symptoms? And you said sometimes infertility may be
Yes.
an issue. So please
Yes.
explain us.
Yes, so we have medical options and then we have surgical options. It all comes down to how bothersome these symptoms are. Now, there are women with endometriosis or fibroids who may actually not have any symptoms, and other people are having, as I mentioned, pain, bleeding, infertility. So, when it comes to bleeding, we can definitely do various hormonal medications, including birth control and the hormonal IUD. Those are the two most popular treatments for both bleeding from fibroids as well as pain from endometriosis. And then when it comes to fertility, most often we want to proceed with surgery, because this is when we can really remove these fibroids, make the uterus sort of a normal shape again, make it favorable for a pregnancy, and to take away some of the risks that fibroids may present later on in pregnancy. So surgery is the favorite option when it comes to fertility. And same with endometriosis. It's the only way to really diagnose endometriosis. You've got to take a look, take some biopsies, really get in there and see what's going on. And we know that endometriosis impacts fertility. Patients who have endometriosis often have a harder time getting pregnant. So the best and most definitive management is surgery. So depending on your goals, we kind of tailor it, whether we're going to do surgery or whether we want to try some medical management.
Excellent. Well, thank you very much for explaining that, Dr. Prabhakar, because the message you're really saying is that you need a trained physician, you need a specialist in the field to make those distinctions. And they're just not something that you can just do by the drop of your hat. You have to evaluate really what route you're going to take. And sometimes, as Dr. Prabhakar mentioned, surgery has a role, is an option, and has to be done. Dr. Prabhakar, we want to now go into a field that is very close to you, and that is the minimally invasive surgery. You've got advanced expertise in this. There is a huge, I would say, now a buzz about robotic surgery. And at the same token, women, when they hear that there's going to be pelvic surgery, they get really freaked out.
Yes.
Explain to our audience, how does this excellent new advancement in your field helps our audience, and helps our audience to understand how to navigate along this pathway?
Yes. So robotic surgery has been an amazing advancement in our field as well as other surgical fields in the last decade. I remember it coming out when I was a resident, and then I did a fellowship to get more trained in it. But essentially, we're doing some of the most complex surgeries with just a few incisions in the abdomen. So I make one in the
Mhm,
belly button, a couple of tiny incisions on either side. They're about
mhm.
5 to 8 millimeters, so really tiny. And we put these instruments in, and then it's the surgeon that's operating. A lot of people think robotic surgery is where you press a button and the robot, starts to do surgery. That is not the case. The surgeon is still
Right.
operating, and we can remove large fibroids. I just removed a 1,000-gram uterus from somebody last week, through
Well,
this small incision. And so, what's great about this is you skip this big cut, which I think a lot of people
sure.
fear, because it's more painful, it's more days in the hospital, there's just more complications. And then B, you go home the same day, which is amazing. You can
Fascinating. Yeah.
be in the comfort of your own home, recover in your own bed. You don't need a bunch of people disturbing you all night, so that's really nice. And C, lastly, for patients who are undergoing fertility, it leaves very little scar tissue, and we have minimal blood loss through robotic surgery compared to open surgery where we make that big cut. And so it definitely offers a lot of benefits. And of course, it takes time to train and expertise to do it, but it makes it such a big difference in my patients' lives. And so that's the predominant way I approach surgery whenever possible, is to be able to do it that way.
Brilliant. So for the audience, you've just explained it and nailed it down so brilliantly, talking about you could remove as a lesion as big as a kilogram from the body with robotic assisted, and yet you're saying they could go home, and
Yes.
that's really fascinating for everyone, and reassures. And then tell us, you mentioned a little bit about the recovery time being less, and there's less scar
Yes.
tissue. Would you say there would be less pain as well as a result of that, because your scar
Yes.
is not only half but one third or one fourth of the size, and it looks a lot prettier because now it's
Exactly.
natural skin. So
Exactly. Yeah. Yeah. The pain is a lot less. So we barely use narcotics for these patients. As you know, we have a lot of narcotic addiction and overuse of narcotics. So we are really careful about using strong painkillers. So oftentimes patients just take Motrin and Tylenol, and then a very few stronger medications. Versus if you did an open surgery, you're needing much more pain medication. And same with blood loss. Blood loss is also minimal. And when you go home, overall, comfort for the patient, cost to the healthcare system, all of these are better. And you're able to walk. I mean, the same night to the next day, you can start walking around and being a little more active. Versus if you had this big incision, you're probably going to be in bed for 4 or 5 days before you really get up and start moving. So it's really a great benefit to the patient if we can do it that way.
excellent. And thank you very much for explaining that. It's quite brilliant. I know we're running out of time. I'm going to try to squeeze in two more questions,
Yeah.
with your permission. One
Yes.
is about some misconceptions about women's preventive health that you frequently encounter. We want you to give our women a message. How would you encourage them to prioritize regular checkups, screening, despite, I know, their busy lifestyles or any cultural stigma some may have
Yeah.
about going to a gynecologist or obstetrician, as a matter of fact? Please,
Yes,
please
absolutely.
explain a little bit your message out. That's very important for them.
Yes, yes. Women are, working hard in society, taking care of kids. We're the backbone of society, I would
Yeah,
say. And
you're
yet, as
very
you
right.
mentioned, many just kind of put themselves back, and not really seeking the care they need. And sometimes they don't know exactly what it is that they need until there's a problem. And so, my big message to women is you need to see a gynecologist every single year. Because not just any doctor, you should see your general doctor as well, but you must see a gynecologist every single year because we advise you on breast cancer screening. We're doing a breast exam.
Brilliant.
We advise you on cervical cancer screening. We're checking your pelvis. And so we're doing all of the appropriate treatments. I'm sorry, the appropriate screening exams that other doctors may miss because this is our specialty and, we take care of women. So making sure you're up to date on the mammogram, making sure you're up to date on a pap test. If you're above 65, a bone density, reminding you of your colonoscopy. These are all things that we remind you of and facilitate. So yes, most importantly, don't neglect these. And I would say the second kind of misconception or thing that message I want to get out there is for women who are undergoing menopause. If this can be a very difficult and challenging time in your lives, make sure you seek help because hormone therapy is safe, and you can just be doing so much better in your lives, in your careers, all of those things with modern medicine. And so, since we have it, we should use it. And seeing a gynecologist
Absolutely.
again will help you make these decisions. And so those are my two main messages.
Oh, those are brilliant advices. I mean, I can't reiterate how important you've touched on general women preventive medicine, but especially women of color. A lot of times in both conditions, they just ride through the pain and they don't bother, or they think there's nothing out there for them. And like you pointed out, guys, there's a lot available. There's these misconceptions about you should not be seeking out help is wrong, and you don't want to end up with having breast cancer out of something pop up on your chest. And some simple screening, Dr. Prabakar is saying, if you even go once a year, an hour visit, and just go through your issues with the doctor. It's so important to plan your life throughout, especially if you're sexually active, and even if you're not active, and after menopause and other times, you need to seek get help and reach out to a specialist so you can get help. Last question, Dr. Prabakar. I know we've already ran a little bit over, and you've been very generous with your time. Um, we want you to give an advice to young women who are in their reproductive health phase, um, and a message. What would you like them to be aware of, and to be mindful about, just in general?
Hmm.
Women in their reproductive phases,
Yep.
and
Yes.
active.
Yes. So this is something, two things that I'll say. One is I'll just repeat what I said about, making sure you see a gynecologist. There's so much medical information and misinformation on social media now. And a lot of young people are using this as, quote unquote, their doctor, which can be dangerous. And so I really recommend that you have a regular gynecologist that you see every year. So that's the first thing. And the second thing is just go back to the basics in terms of eating well and moving well. I think this is such a overlooked and underestimated tool.
Sure.
We are constantly looking for the newest medication, the fanciest surgery, the whatever is up and coming to help us with our health. But so
Hmm.
much of it is just really basic, and spending the time and effort to do that well. And if you don't know how to do that well, there's so many coaches out there and doctors who can help you. So going and seeking those resources can really help, because if you can do that right, you can avoid a lot of disease, including a lot of these conditions that we just talked about.
Absolutely brilliant. And thank you very much. It was such an engaging, brilliant discussion. Dr. Prabhakar,
Yeah,
thank you
thank
very
you
much
so
for
much.
sharing your valuable insight. It was brilliant. It was really enlightening.
Thank you so much for having me. I really appreciate it.
Thank you. And to our amazing audience, thank you for tuning in to another episode of Khan Klinics. If you enjoyed the show, please share it with your friends. Don't forget to give us a thumbs up. Hit the subscribe button and feel free to drop your comments. Your comments are very critical. We always love hearing from you guys.